Lidocaine is the anesthetic that's used for local anesthesia on almost all wounds done on an outpatient basis. You use a very tiny needle, it hurts less that way, and you'll notice I'm injecting into the edges of the wound because if you puncture the skin it's going to hurt more. It's relatively painless. I'm using lidocaine with epinephrine. The solution is 1%, that's 10 milligrams per cc of lidocaine. You do not want to use more than 3 milligrams per kilogram if you're ever trying to figure out how much can I use. So this is how you numb up a wound. Because it's got lidocaine, it blanches the edges. Everything here is going to stay sterile. And we'll have our suture material, our suture needle holder. We've got our scissors. So here we are, we're now draping the patient. You want to maintain a sterile field, putting on sterile gloves. I'd forgotten to put my glasses on prior, so I have those put in. And now we're suturing with 6O sutures. This is the finest suture material you can find. And once you've entered through the wound, you pull through carefully, and then you want to find a way not to lose your needle once you've gone through the second side of this wound. The first suture is always placed right in the middle of the wound. You want to divide the wound in half, as you see we're doing here, and then secure your needle so you don't lose it on the other side so you can pull it through. And then it's just a matter of the very first knot. You go around twice, 1, 2. And pull gently. If you pull too hard with 6O suture, you're going to break it right off. But you want to make that knot snug. And then it's just back and forth, like tying a knot, but you don't want to have a granny knot. So you go one way and then the other way with the following knot. And I usually put 5, 6, or 7 times that you're tying these knots because you don't want them to unravel later after the patient leaves. I want to mention that the lidocaine, when you use lidocaine with epinephrine, you do not use this on fingers, toes, penis, or ears or nose. It can compromise the circulation, and so that's only used for other wounds, but can be very helpful if you need to decrease bleeding and have the anesthesia last for a longer time. Now, once you've divided the wound in half, you want to decide, do you need to divide the other half again in two, or in this case it looked like a wound that just needed 5 stitches, so you'll see I put the rest of each side is going to have 2 sutures, so you get a nice even distribution of your stitches. This avoids getting a dog tag. Some people who might start suturing on one end, by the time you get to the other end you've realized, oops, we've pulled too much tissue from one side, not the other. Now, what made this particular suture job especially difficult was, as you can see, her mouth is moving almost continually. She was protesting. She really was not having any pain from the suture procedure. You can see her whole chin is blanched, but she didn't like being held. And this is a common challenge. So do you use a papoose board, which is a rigid board with Velcro straps? And we have a papoose board. I have found that if you have good holders, the human touch often will allow the child to relax a little better. Although in retrospect, of course, you wonder because she certainly didn't relax as we were going through this entire video. Now, she had been in the emergency room previously for a suture job, and this was part of the reason she was so traumatized in the sense of just protesting throughout this suture procedure. But she definitely didn't like being held down, and I had great supporters here. One's holding arms down so she can't reach up and grab the sterile field, and I have another nurse holding the head as steady as she can, and all I'm having to deal with is the chin that's moving back and forth. So one of the other things I'll just mention while we're watching this video of these sutures going in is, let's say you were suturing a different part of the body. It's very important in your examination of a wound to find out that the person still has normal sensation. Let's say you're doing a hand or a foot or an arm. Do the muscles work? Has there been any injury to tendons? And is there good blood flow to the area? If you have problems with either sensation, which would be neurological damage, problems with muscles working correctly, or perfusion, you probably ought to refer that to a trauma center or someone who's very skilled at that sort of repair. The other issue with regards to placing sutures is how old can the wound be? Now, most wounds can be sutured up to 24 hours, but for sure under 12 hours is not a problem. If it's the face, I would even go up to 24 hours because it's so important for cosmetic outcome to get a close approximation of the edges. But any older than that, it's just too risky. If you close that wound, there's probably bacteria in the tissue, and that's when you get a wound that abscesses and just you have a whole lot of pus coming up. And you want to avoid that if you at all possibly can. So one of the other issues is tetanus prophylaxis. Anytime you have a wound, you need to be sure that that person who's been injured is up to date on their tetanus prophylaxis. The mortality rate from tetanus is up to 20%. This is not something to take lightly. Dirty wounds are those contaminated with saliva, feces, dirt, or burn injuries. And if that's the case, you need to have had a tetanus prophylaxis dose, a booster of your immunization within the last 5 years. Now in children, they need to be up to date. And so if you're not a pediatrician or family practice, you would need to look at your books and see what is required for the age of that child. Generally by age 4 or 5, you've had a series that includes up to 5 shots that include the tetanus. So what kind of sutures do you use for what kind of wound? For a wound that has cosmetic issues like a face, you're going to use the tiniest needle, the tiniest sutures. These are 6-0. Anything else that's superficial, 5-0, but if it's a high tension like a joint or a scalp, it's a 4-0 suture. Now you want to give your patient good follow-up instructions. When do they need to come back? What do they need to look for? Well, watch for signs of infection. That's spreading redness out from the wound, and heat, pus, swelling. These are your signs of inflammation. If there's dressings, you want to keep them wet, you don't want to have them be wet, you want them dry, and if they're dirty, you need to change them. Suture removal is in 4 to 5 days for the face, 7 to 10 days for most other, 14 days if it's over a joint.